So one of the things, of course, that comes up a lot when treating patients, whether surgical or not, has to do with why medical care is so expensive. So, I mean, that's been this whole kind of national issue, and we had Obamacare, and then we didn't have Obamacare. Now we have it sort of again. But the whole point being, there are all these mechanisms to control the costs of medical care. And so specifically, that's really one of those, you could pretty much write a dissertation on why that's the case. Specifically with regards to hospitals, why is it so expensive? And ultimately, I think that, that's multifactorial. However, the biggest reason is because of the overhead of the hospital is built into the cost. So ultimately, we look at Medicare, which kind of sets prices. The Center for Medicare and Medicaid Services pretty much sets prices, or at least baselines, and people kind of, and insurance companies kind of go off of that as the baseline. And so automatically, because, hospitals, not only do they have a good lobby, they also, do have service in the community. So it's kind of in the public interest to keep them solvent for the most part, even though that's, becoming more of an issue. But the bottom line is that high overhead is built in to the costs, and this is termed the facility fee. So the facility fee automatically raises the price of everything. And that just goes into the fact that, you go into these big sprawling hospitals, these big institutions, it takes a certain amount of money to run that. And obviously that's, increasing even with the kind of inflationary pressures that we have right now. So ultimately that's where the cost comes in. I mean, you could really get into the weeds on exactly, which parts of the cost, like why does some medication cost so much and this and that. But say, for example, the comparison would be, why are we kind of steering patients to the surgery center versus the hospital? And automatically, for the payer, for the insurance company, and the patient, the actual bill itself is, significantly lower. And that's just because not being in the hospital, there's not so much overhead baked into the cost. And so it's definitely economical, and it's a thing where more and more it's being recognized by insurance companies and government payers that, treating in an outpatient setting is just more economical across the board. And so, there's this structural high cost in the hospital. And so that's one of the things we're trying to solve by developing our surgery center, and other groups have done the same. And it's one of the reasons you see these surgery centers springing up pretty much kind of everywhere you go.